All right, let's head into the papers now, see what the headlines are in Nigeria. I have with me Jide Ologun in the studio to help us make sense of some of the headlines. Jide, good morning.
You're welcome.
Nice to see you.
Thank you.
Great. Let's begin with the News Direct newspaper this morning. News Direct says COVID-19 treatment. Federal government warns against the use of Kano-made vaccine. 90% of coronavirus patients in Nigeria will recover, Health Minister assures of this. And NDDC discovers 117 new cases, orders probe of 450 deaths in Kano. The state government set to ascertain cause of death. That's what you see on the front page of News Direct. In fact, the issue from Kano has been very disturbing, I must say, and I guess my guests would like to talk about this. Let's go to the Blueprint. Blueprint newspaper says, also on COVID-19, come to our rescue. Ganduje begs Buhari. Kano probes rising deaths. Northern governors ban Almajiri to return kids to states of origin. That's what you see on the Blueprint. Federal government begins distribution of drugs and medical equipment to Kano, Osun, and 23 killed, scores brutalized by security agents. As a report is saying that Lagos discharges 9 more cases. All right. You find all that on the front page of the Blueprint newspaper. Now from Blueprint, let's go to Daily Trust. Daily Trust is the next paper now, as attention shift to COVID-19 in states. Malaria, BP, diabetes, or diabetes patients, others face tough time, all right, because attention has shifted. Now, COVID-19, Ganduje cries out to federal government for help. Katsina restricts visit to state-owned hospitals, and suspicion led to death of woman in Anambra, and drugs scarce, expensive in Osun. 70-year-old patient battles for life in Bauchi after discharge. All right, you find all that on the front page of the Daily Trust. All right. Now, Leadership newspaper is the last one we're seeing right now. Leadership says another extension likely as WHO warns against lifting of lockdown. Now, PMB to receive, that's President Muhammadu Buhari, to receive progress report on FCT, Lagos and Ogun. And writes CJN orders another prison decongestion, and UN warns of global hunger. And Oshibajo, IMF, World Bank review federal government's economic stimulus package. Kwankwaso donates 60-bed isolation center. COVID-19 vaccine to be tested in UK from tomorrow. All right, that will be cherry news there for a lot of people. All right, Jide, let me come to you on this. The case of strange deaths in Kano has really raised a lot of concern, and a lot of people initially said it was COVID-19. But the point there is, so long as there were no tests and verifications, one cannot say it's COVID-19. So that is, at least as far as the books are concerned, except if the test is made and there are verifications by the authorities to say, actually, these people died of COVID-19. But what do you make of those kind of a strange occurrence at this time?
It's quite disturbing, but like you said, one would have expected that through autopsy, the cause of death should have been discovered. But the state claims to still be investigating the cause of death. And you know that Kano is densely populated. So we hope that it has nothing or little to do with COVID-19, because if it is COVID-19 related, then we have a serious crisis in our hands, because you know also that the incidence of COVID-19 is rising too in Kano. And one of the steps that the governor has carried out is to call on the federal government for assistance. And I believe that materials, particularly medical, has been transferred to Kano. But again, some are trying to take advantage by coming up with fake vaccine, and the government is also warning about that. So a lot of things need to be done now. And I think this is the moment that some of us who are already looking beyond COVID-19 should start advising the government on the need to strengthen states. I'm worried that states need to cry out the federal government for support and things like that, because I was reading a report, particularly in the case of Katsina State, that they don't even have a testing facility, and it takes about 12 hours to transport this material to the FCT and back. So we need to go back and see how prepared we are to cope with the demands of good governance. And it's a serious concern for me, because
all right. Over the weekend, the last weekend, there was a video that went viral of a football match in Kano, and it called to question the knowledge or the awareness or the enlightenment of the people as to the issues of lockdown, the issues of social distancing, how real COVID-19 is. How much of that do you think is going down to the grassroots?
They all will contribute to making the matter worse, because you must prevent. And they say that prevention is better than cure. And we are now dealing with a virus that is reportedly incurable. But thank God for Nigeria. Nigeria has been recording cases of those who are recovering from COVID-19. And talking about
most countries of the world.
Exactly. And talking about the orientation, we need to do a lot more on that. I mean, you just spoke about the football match or whatever. What about the young people who came out and started shouting, no coronavirus, no coronavirus? We need to get people on the platform of being informed. But that is a long-term process. And we have the National Orientation Agency that should rise up now and begin to engage the people. But I believe that with the death of a high-profile personality in the person of the Chief of Staff to the federal government, the late Abakari, some Nigerians are beginning to realize that, oh, this is real. And the government is also responding by localizing the response. I mean, we are not waiting on China to bring us face masks. We can now use our own fabric in the country to produce face masks. And some of us expect that when we pass through this valley, we should come to the mountain of local capacity development, knowing now that you are on your own. There's even a report that the medical officials that were flown in from China, that the government does not even know what they are here to do. So we need to develop local capacity going forward, so that when we are strong in the days of peace, when trouble comes, we should be able to cope better. And there are several lessons to learn here.
All right. Now, the issue of the lockdown, there are, from, feelers we're getting here and there, they're saying that the lockdown could still be extended. There's a likelihood of extending the lockdown. What are you looking at when it comes? Because the people are fatigued, people are bored and tired, but the lockdown is necessary to stay safe, especially considering the fact that the numbers are rising by the day.
Yeah, but some have said, erroneously so, that they would rather die of COVID-19 than of hunger. So there are issues here. And we are being warned now that there will be great famine following this. So my advice to the government is that while managing this crisis, let's go to the foundation of our own national crisis of poverty. And right now, can we go back and see how we can resolve the crisis of Boko Haram, of herdsmen that are killing, knowing that we have fertile ground, we can go back to farming. And I just want to quickly roll out the 5 steps that Singapore took in migrating from a poor country with little resources, to a frontline nation. It's the most successful out of the 5 Asian tigers. And you talk about pragmatic leadership. How can we practically solve our problems that will bring maximum benefits to the maximum of the people? Then you talk of effective public bureaucracy. All right. You talk about effective control of corruption.
All right.
And you talk about, letting the best of brains handle issues, not based on tribe or political affiliations. And you talk of learning from other countries to develop our local capacity. And when we put all this together, we should be able to withstand
All right.
whether the famine that is coming or not.
Okay.
And God will help us through.
That's our prayer, and that's
Yeah.
what we do much in this country. Thank you very much, Jide Ologun, for your
God
time.
bless
on the
Nigeria.
program. Thank you. Let's head into the paper, see what the headlines are, and I have with me a lawyer and public affairs analyst, Jide Ologun, to make us help us make sense of the headlines. Jide, good morning.
You're welcome.
Nice to see you. Good. News Direct newspaper is where we'll start from this morning. News Direct is focusing on COVID-19 treatment, and it says federal government warns against the use of Kano-made vaccine, and NCDC discovers 117 new cases and orders probe of 150 deaths in Kano. A state government yet to ascertain cause of death. 90% of coronavirus patients in Nigeria will recover. Health Minister is assuring on this. These are stories on the front page of the News Direct. Blueprint is next. The Blueprint is also talking about COVID-19. Come to our rescue, Ganduje begs Buhari. And Kano probes rising deaths, and Lagos discharges 9 more cases. Federal government begins distribution of drugs, medical equipment to Kano, Osun, and 23 killed, scores brutalized by security agents, as a report is saying that. And northern governors ban Al-Majiri to return kids to states of origin. All that on the front page of the Blueprint newspaper. Daily Trust is next now, and he said as prevention shift to, or attention rather, shift to COVID-19 in states, malaria, BP, diabetes patients, others face tough time. And Katsina restricts visit to state-owned hospitals, and suspicion led to death of woman in Anambra. Drugs scarce, expensive in Osun, and 70-year-old patient battles for life in Bauchi after discharge. All right, and Ganduje cries out to federal government for help. You find all that on the front page of the Daily Trust newspaper. Leadership newspaper is the last we're looking at right now. And it says another extension likely as WHO warns against lifting of lockdown. PMB to receive progress report on FCT, Lagos and Ogun. Writes CJN orders another prison decongestion. UN warns of global hunger. Oshibajo IMF World Bank review federal government's economic stimulus package. Kwankwaso donates a 60-bed isolation center, and that's in Kano. A COVID-19 vaccine to be tested in UK from tomorrow. All that on the front page of the Leadership newspaper. And Jide, I like us to start it from this headline on the Leadership newspaper, saying another extension likely as WHO warns against lifting of lockdown. Just how difficult is it right now to reconcile the fact that a lot of people who survive based on what they do on a daily basis have to be told to stay home on the lockdown, stay at home, don't go out, and all of that, no activity, and preventing against the spread of COVID-19. How difficult is it right now for government to balance that kind of a decision at this time?
Certainly, it's going to be a difficult one. Even the current directive is not fully complied with. I can tell you that in parts of Ogun State, even Lagos State, people are already coming out to do business. And like you said, quite a high percentage of the people who are expected to stay at home are within the poverty bracket. So, and quite a number of them earn wages daily. And while commending the efforts of the government at the federal and state level to extend palliatives to the citizens, the challenge is quite overwhelming, because I don't know how much the palliatives can go, and this is a big challenge for us. But I understand that the president will be meeting the presidential task force on COVID-19 for advice, but we have been warned that we may expect some tougher directives. Whether the lockdown will continue is a different thing, but if I can study the body language of the government, I think right now in Lagos State there is a mass production of face masks that may be given to residents so that when they come out under a new regulation, they can prevent the spread of the coronavirus. And then I know already that even before now, in Cross River State, Governor Ben Ayade has directed the garment factory to mass produce face masks.
It's the same thing in Bayelsa.
Exactly, and in Bayelsa State. And of course, the federal government has endorsed the use of our Ankara, our local fabric, to design the face mask. So
and they look beautiful, really.
Exactly,
beautiful
and I see us migrating to where we should have been, which is developing the local capacity. Now, the United Nations is threatening that there will be hunger after COVID-19. Fine, it's not all the nations of the world that will suffer from the hunger. You know, a wise man said that the poor man buys luxury first, but the rich man buys luxury last. And so we have not prioritized the engagement of our resources in Nigeria, and that's where we are, why we are where we are now. And we are advising that, paying attention to that wise counsel, can we now look at our agro sector in the country? How can we ensure that the diversification into farming that sustained us before the discovery of oil is effective? We still have the challenge of herdsmen killing. We still have Boko Haram. So where will the farmers go back to? And if there is no security, prosperity remains threatened. So the government should sit back now, look at how the policy can be refined in a way that we embark on the path of prosperity. It's very crucial. If not, the threats from the world at large may catch up with us. But we don't need those threats anymore.
All right. Now, some states have a lockdown in place or stay-at-home order, but relax it after some days for people to stock up a little again before it is imposed. Now, some analysts have said that is counterproductive, because the moment you give any room for people to mingle again before you go back in, those who because a lot of people are asymptomatic, as the case may be, at that period of time, it can also that it could be counterproductive, because they can also pass on whatever they have.
I quite agree with that, but it's now between the deep Red Sea and the devil. Because we are even talking about allowing people to go for shopping. As at this morning, the inflation rate in my great country is 12.26%. The highest in 23 months. And the money, maybe for those of us we've been on the field extending palliatives, and we know the enormity of poverty in Nigeria. A lot of people are groaning. In fact, the definition of the vulnerable must be extended seriously. And that is the challenge. The economy is critical in any nation. And of course, it may be easier if the government has the capacity to keep people at home. But that also appears not to be there. And in some countries of the world, they are already saying, no, we have to start reopening businesses, because you don't lock down business for too long. I know in Dubai, that move is there, even in the US, in Ghana, and some other areas. So the government must find a way that we balance the management of COVID-19 and the management of the negative impact on the people, socio-economy. Because right now we also know that the crime rate is rising so much. And we also know that the people are beginning to take laws into their hands by doctrine of necessity. Because in many communities, landlords and residents have reason to say, we will watch over our community if the government cannot watch over us. And that is another dangerous trend, because when you talk of revolution, when people begin to gather to defend their territories, someday they may come out to defend their fundamental human rights through that collaboration. So the government needs to be very careful now and go back to Section 14, subsection 2 of the Nigerian Constitution 1999 as amended, that says that the security and the welfare of the people shall be the primary purpose of government. So when we go back to the primary purpose of government, we can manage this crisis effectively and come out of it stronger as a nation.
It's all right. Thank you very much, Jide Ologun, for your time on the program.
God bless Nigeria.